Ladies and gentlemen, and welcome back here to our channel, Invisalign for Doctors. My name is Dr. Adriano, and today we're going to talk a little bit more about the basics of biomechanics with the appliance Invisalign. So what does it mean? That we are going to see actually how does it work, the tooth movement. And to talk about biomechanics, actually we can't look over here, who is our mentor, and probably for every single orthodontist. This is the man that, who doesn't know, is Charles Burston. That is the first time I have attended one of his courses, like hands-on with segmented arching in Unesp Araraquara, that when I got my master. And after a few years, and also in Brazil, I translate one of his courses. Here I am, and here's Dr. Burston, but unfortunately he's not with us anymore. And actually I have over here, let's just see, I don't remember if we type here Dr. Burston or orthodontics, let's see, I'm sure they have like more than 100 papers. Here we go. There's a lot of papers published. And but let's see one of the first, just to see when he kind of like changed the history of orthodontics, because talk about biomechanics, 1962, talking about biomechanics and orthodontics, it's, I would say, is almost before and after Dr. Charles Burston, because he started to show everybody, like introduce the system of force, and we start to think in how much grams or newton we needed to move, what is moment, and how to control the side effects. And then also it's a lot easier to think and plan our case with different segments. So we are talking about his concept it's more than what, 60, 70 years ago. And why I'm talking about that, but believe it or not, the Invisalign, it's with the most advanced appliance that we have. We need to use some biomechanics concept from almost, I'm saying, like 57 years ago. So why? Because we need to think as an anchorage all the time before we control our tooth movement. Most of the orthodontists, I don't know most, but most of the beginners, they don't know that we are working with clear aligners, and clear aligners, we always need to have it's a plastic, is like a, I would say, we need to, if you want to move one side or one tooth, you have to have an anchorage for the other side, because if in other hands, the aligner wouldn't stop in the mouth. When you activate it too much, that's why it's like mesial distal, the software is programmed to move like each 0.25 millimeters, each aligner. So how can you control and understand better this kind of movement? I'm gonna show you guys right now. If you, like I'm saying, most of the younger orthodontists that has been, or the people that is starting with the Invisalign, they don't probably know that we have actually 6 anchors in the upper and lower arch. So the molar, the first molar is one anchor. I'm gonna explain right away what is an anchor. It's like, but it's like an anchorage, It's like the 2 centers, and this is the canine, and this is our molar. So that what does it mean? That actually, if you start to distalize distal mesial movement of your molar, you're gonna observe, like usually you're gonna have like some gaps over here, you're gonna have spaces here, but not on all the rest. You're gonna see more over here. And why? Because this is one anchor and this is another anchor. So again, like I was saying in the beginning of this presentation, that we need to actually think as a segment. So this is one segment that we have over here, molar and asta into second molar. This would be another segment, this would be another segment, and this will be another segment. And it depends on what kind of movement you want. You need to keep all the other segments as an anchorage. So like the segmented arch, you need to have a passive segment and always an active. And can you move all the segments in the same time? Can I move this in this direction, this in this direction, and here too? Of course you can. You can move whatever you want with the 3D control, you know. But what we really recommend, if you are gonna distalize this segment, for example, would be a really smart idea. Don't move this anchorage over here. Actually, depending on how much you're gonna move this segment, would be a really smart idea not change this anchor as well. So you have like an anchorage to move from this left to the right. So if you're moving too much over here, depending on if you wanna do like in sequential or are you gonna do like as a segment, depending if you are working with elastics or TEDs or something, is a different point of view. But when we have the aligners by itself, you always need to keep all the other teeth as an anchorage, depending on how much you are gonna you're gonna move your teeth. So you're saying, Adriano, that I can never move all the anchors in the same time? No, I'm not saying that. If you want, you can. But it's like depending on what kind of tooth movement you want. You know what I'm saying? For example, if it's minor kind of movement, it's like you put the braces on and put the 014 and night tie and let the wires works, because you're gonna move everything in the same way. You know, here's the same. Here is exactly the same thing. You know, if you have a minor movements, of course you can move all these anchor teeth in the same way. But in other hands, if you have to distalize a lot, you need to upright to some molars, or you want some impacted canine. Anyways, if you want a huge type of a large movement, you need to do with orthodontics with the braces, for example. The good orthodontists, they would kind of prepare the anchorage before, and most of the times they work with bypass, or they don't touch for a while and that problem teeth before they prepare the anchorage. Here's the good thing in Invisalign. You don't need to wait until you have like a 19 by 25 stainless steel wire before you prepare your anchorage. You just do your clean check, and you can start to move your I would say your tooth problem right away. But you need to think about that. So that, I think, it's a really important review that I'm showing you guys, and this is one example. It's a simple example. If you see, it's not like a large movement, but this molar, the 2.6, I'm kind of move buccally, and but what I supposed to do if I want to keep like a efficient movement without lose track with my other aligners, with the other segments, with the other teeth, you know what I'm saying? So if you're gonna see here, this premolar and this molar, I basically don't move. Actually, the other side too, these are the anchor, and this anchor as well, and this as well. I basically just rotate a little bit, and these two, of course, is far away, these two anchors, and it's not too much. It was just tipping, so I move in the same time. So let's see what's really happened over here. You're gonna see, look, see, I am already on the aligner 3 and the stage 4, 5, and I still have anchorage here, anchorage here. This I need to gain a little space, so I'm rotating like measly to gain space. In the same time, I have the efficient move for buccal side. And then you see all the others, you know. So now you can see, let's go into the end. So here it is, the molar. See, it's really efficient. You know, and in the mouth is the same way, you know, if you don't want to lose your track, and has to do some refinish all the time. So we start to think with biomechanics, work with segments, and with active and passive segments, they're gonna help you a lot. If we're gonna, so here now we have always the table, we can here see We are gonna have like the buccal, the 2.6, the one we are kind of moving the most. But if you see over here 7, we don't change anything. On the other side, basically the 1.6, the 1.7, I'm gonna moving. I have changed, of course, some rotations. That's what we need the most. It's okay, but basic, we have control, and we have I would say work on different kind of anchorage to control better the tooth movement. So remember that, okay? Remember that all the time you're gonna start to plan, think with segments, think which the anchors that Invisalign always has the anchorage, and we are talking about the 2 incisors, the canines, and the first premolar, and based on this this kind of anchors, you're gonna start to design and your system force. Okay, so thank you very much for your attention, and if you wanna follow more biomechanics, this is the basic one, of course, you're starting, and but I'm sure will be a lot of more good information when we're gonna start to about biomechanics, rotations, and mainly with torque and tipping control. We're gonna have a lot of things to say over here, so I hope to see you guys very soon again. Okay, have a good day.